Good morning, Dr. Tammy here. Today it was kind of interesting. I was out in the nurses station talking with them a little bit, and so my nurse said she's lost 10 pounds doing the mix shots, which are basically a B complex shot that we do here in the office, and she was all excited. And I had another patient over the weekend who's actually a friend of mine who's having some migraines. She Facebooked and said, anybody get a cure for migraines? And so I wrote in magnesium, and I said up to 1,000 milligrams. And so when I saw her over the weekend, she's like, that worked. And people always look so surprised when I tell them nutritional or alternative things, because I think that our culture just teaches us that the junk food we eat, the McDonald's, the sodas, all those things that we do are all okay. And if you have a problem, a headache, or you have something that doesn't feel right, a joint pain, then there's a pharmaceutical for that. There's a take a pill for that. But just they're so surprised when there's some nutritional answer for that or when we're deficient. And so I spent a lot of time educating people that we're a terribly iodine deficient society. Our thyroids aren't working. We're getting these big goiters. We're tired all the time. We're a terribly B vitamin deficient society. And then there are all sorts of other factors, genetic factors where people maybe don't absorb their nutrients very well. And so identifying those things is so important. And that's part of what I do and my staff here does, is help people identify those deficiencies. One of the things that I love to help my migraine people with, and I just had a lady who's been a dear friend patient of mine for a while, who was having terrible migraines. We were maxed out on her pharmaceuticals, her Imitrex, or all those things that people take for migraines. Even doing Botox injections in her neck and her face for her migraines. Nothing was really working. Even tried oxygen therapy. And so finally I said, here, just take a bottle of this. This is, I don't know if you can see this very well. This is our magnesium, but it's very interesting because it has magnesium and B6 in it. And the B6 is actually a cofactor that helps the enzymes work better to get the magnesium into the cell. And so I said, just start taking one a day. If you get a headache, take 4, which she was having almost daily headaches. And so she was so surprised when I saw her last visit. She said that magnesium really works. So if you have chronic headaches, chronic migraines, I know you don't want to buy into that. It could be as easy as a magnesium deficiency, but why is it that people want to try pharmaceuticals and they want to do all these other things first and not look to their diet and their nutrition? That's always a last resort. So I say make it your first resort. I love magnesium. Magnesium helps the fat burning process because it helps activate the enzymes in the cells that actually do your cellular respiration and your metabolism. So magnesium is very important for that. If you have any constipation issues, not only is the food sitting around longer and absorbing calories longer, but magnesium is a smooth muscle relaxer, so it actually relaxes the gut and relieves that constipation. It's also a skeletal muscle relaxer, so if you have a lot of tension in the muscles of the face or the neck and that's causing your headaches, it helps with that. But because it's a smooth muscle relaxer, the blood vessels also are lined with smooth muscle. So if you're not getting enough magnesium, you're more prone to have high blood pressure. I have patients all the time who are so surprised, and I'm very surprised, that doctors have put them on a ton of blood pressure medications when really all they needed to do was be educated about counting sodium grams. They'll say, well, I don't salt at the table, but it's completely different counting sodium grams because there's sodium in everything that you're not even aware of, especially prepackaged foods. And when you eat out, there's a ton of sodium and stuff. So you might not think that you salt at the table, but you're getting sodium, I promise you. So anyway, I use magnesium for blood pressure all the time. We use magnesium for pregnant women for blood pressure because we know that pharmaceuticals aren't safe. A lot of the blood pressure medicines aren't safe in pregnant women. So, it's so funny to me that we're very aware that we want to protect our pregnant women. Why don't we want to protect everybody? Why don't we tell them magnesium first when they have a blood pressure problem? So anyway, just a little plug for magnesium. We do sell this in our office. I love magnesium. Use it every single day. I love the B6 that's in here. Paroxetine actually helps the metabolic process as well. So, and there's just something a little extra that helps you absorb your B12 with pyridoxine. So lots of interesting things. There's some great websites you can go read up more on magnesium. But bottom line, headaches, blood pressure problems, constipation. You're probably magnesium deficient, as almost everybody is. You get magnesium from green leafy vegetables, fish, tuna mostly, salmon. So lots of good places you can get magnesium, but we are a terribly deficient society. So if you have any of those symptoms, go to magnesium first, and then then we can talk about other options later. So anyway, my little plug for magnesium today. Hope you all have a great and fabulous weekend, and we'll see you soon.